Good morning, everyone. We will get started. My name is Farah, and I am one of the therapists working at the Lighthouse. And I have a specialty in working with health, trauma, cancer care, grief, depression, and I also serve as the director of our mental health first aid program. And I hope everyone can hear me okay. I'm going to speak today about the importance of mental health and cancer, and what's common to be feeling if you, a loved one, or a colleague has recently received a diagnosis, is waiting for test results, is living with a cancer diagnosis, or if you are a friend, family member, or loved one of someone who has had any of those experiences, what you can do to take care of yourself and what you should and should not do in regards to supporting that person in your life. I'll speak for about 45 minutes and then we'll have 15 minutes at the end of today's session for Q&A. The session will be recorded and sent to you afterwards. So I will share my screen with you. Right. So what we're going to talk about today is what's common to be feeling when we have a close scare with cancer, or it touches our life or a loved one's life in some way, or even in our workplaces. What's common to be feeling when that scare or experience is fresh and new in your thoughts, your feelings, and your body. We'll talk about how to care for yourself, how to support others, and then we'll have Q&A. Okay, so I want you to know when we're thinking about who can be impacted, I've mentioned this a bit now, but when we think of, as soon as we think of cancer, even though many cancers are quite treatable, the first visceral reaction we typically have is death. Okay, it can be quite traumatic to even sit with this word. And even as you're sitting with all of the content of today's session, you may be feeling a little bit heavy or anxious. So I encourage all of us to take a deep breath, right? And bring your whole self into the space. I want you to know that when we think of cancer, it can be a traumatic experience, and trauma is any emotionally overwhelming experience that we don't have the tools to navigate. That's the broadest definition of a traumatic experience, right? So we will be talking about, well, what is trauma and how do you navigate that time? So if you have recently received a diagnosis or a loved one has, if you're waiting for results or biopsy results, if you are currently living with cancer, that is also a traumatic experience for many. If you are a survivor, if you are a survivor in remission and you are waiting for test results, if you have a close loved one that has lived with cancer, had a close scare, and you have an annual test that you're going to, even though you're like, okay, everything seems okay, but if you've had a close encounter with cancer, then waiting for results or even those annual exams can be quite alarming and terrifying because you have that inner template of what can happen, right? This also includes if you've experienced a loss to someone or a loved one or a colleague with cancer as well, where you can experience the symptoms of trauma. And also secondary trauma. This would mean that by just hearing about, witnessing, or being a caregiver to someone who has cancer, you can also experience secondary trauma, right? Even if you are not close to the person, we can be deeply impacted when we know someone around us in our community, regardless of closeness, there's been a scare or any of these scenarios, okay? So this is what we're talking about today. Now, what's common to feel when any of these scenarios are fresh, meaning either something's coming up or has just happened and you're sitting with that news, right? So we would describe this experience as an acute stress reaction. So think of that as an invisible injury, right? So the person may be functioning okay, or you may be functioning okay and thinking, okay, I feel kind of okay, but I don't feel like myself, right? So when you're waiting for a diagnosis or you've been given a diagnosis, it is a huge invisible injury. And many people can describe these moments as a fragmentation or fracturing of self, where it can feel like you don't know what is up, down, left, or right. Now, it's so important that if this is someone in your life, they may look or appear okay or strong, but we're naming that there is an invisible injury inside of them, right? So during this time, I usually say to individuals, if you could see your heart and soul, you would need to be in the ICU. And just because you are functioning, it doesn't actually mean that you are okay. So it's a psychological injury, right? And I'm emphasizing this is not just for people living with cancer or who have received a diagnosis. This can also be when you are waiting for results, or you're in remission and you're again waiting for results, or going to doctor's appointments, or even when diagnosis is really fresh. This is when we can see some of these symptoms. Or if a loved one has recently been diagnosed, right? We can see all of this. These symptoms of an acute stress reaction. And we're now going to deep dive into what is normal during that time or common. I need you to know that each person's reaction to the trauma of a close encounter with cancer will be as unique as their fingerprint. There's really no right or wrong way to respond. Some people may cry, some people may freeze, some people may become highly functional. There's no right or wrong way. Okay, so let's take a closer look at some of the common trauma responses in those early days that can take place. So one is, you may see some people feeling really panicked. We call this hyperarousal. So they may be feeling highly anxious. There may be rage or anger. How could this happen to me or to someone in my life? There may be irritability, unable to switch off thoughts. This is really common, right? And this reaction to a close encounter with cancer is not wrong, right? This is actually quite normal to feel, although I don't like the word normal, but these are common reactions to have. There can be a struggle to sleep or concentrate. There can be nervousness or even trembling and intrusive thoughts. So the mind may be racing to the worst case scenario. My loved one will not make it, or they will not survive, or I will not survive. And the mind is jumping to that worst case scenario. So think of this time as the home alarm. Like, we have this little P-like structure in our brain called the amygdala, and it starts short circuiting with trauma. So it's like a home alarm system that becomes hypervigilant and hypersensitive. So even just the wind blows past the alarm system and it starts going off. And that's what's happening in our mind and body when there's a close encounter with cancer in our lives or in a loved one's life. And the mind is jumping to that worst case scenario. This is very common in those first few days and weeks when the injury is fresh. Now, other people may actually have more of a freeze response where they shut down, they feel dead inside, they feel empty, they feel numb, they say they feel nothing. They may say, I feel like I'm in like this dream-like state. I don't know, like, is this real? There can be shock and disbelief, feeling a bit paralyzed. And again, there's no right or wrong, right? I find that for many people, they can actually swing between hypervigilance, that fiery-like state, and also feeling frozen. And we know the typical course is there can be more of this at the beginning, right? Where the body's in the state of fear and your body actually can't sustain that for a long time. So then it kind of goes into the state of feeling a bit frozen, exhaustion, depleted, very tired, even though it may be quite hard to sleep when the injury is quite fresh, right? Now, there's another cluster of reactions that I observe, which is This person may become very, very task focused. They may start researching everything, researching absolutely everything about illnesses, treatments, insurance, billing, payment, doctors. And you're like, wow, they're really strong. Like they're really being helpful. And remember, this can be the person with the close encounter, wherever they're at in their journey. And it can also be friends, family members, and caregivers, where they're saying, I need to feel in control and like I'm being helpful. So they become very action oriented. And it doesn't mean that this person is strong. It actually just means that they are functioning. Now, this person will usually have more of a delayed reaction, where in the coming weeks or months, perhaps when things have stabilized or there's just a little bit more space for them, that is when you begin to see more of that trauma reaction begin to surface in their mind, in their emotions, or in their body. Okay. And in many ways, they're numbing what they're feeling to show up and practically be helpful, but it doesn't actually mean that they're okay. Right. So these are 3 clusters of reaction we can see when the injury is quite fresh. And for many people on a journey with cancer, there can be so many ups and downs in that journey. So you can imagine that, you know, I think of the clients that I've worked with where a trauma reaction is common when you're waiting for results, that uncertainty and that unknown, receiving a diagnosis. You can see some stabilization as they go through treatments. And there can be wavering optimism, sadness, and every emotion you can possibly think of. And then you see a trauma reaction again when then you're doing that scan again to say, okay, has the chemo or treatment been successful? And even that time, you can see a surge of trauma reactions within the course of living with cancer. And remember, I'm not just speaking about that individual. I am also speaking about trauma reactions in family, friends, colleagues, and the community around that person who are also experiencing trauma. And many people will tend to minimize that. They'll say, well, I'm not living with it. That person is, so I shouldn't feel this way. You are also impacted. When we think of secondary trauma, it's like the shrapnel that comes out from that primary injury. So make sure you're being curious about what's coming up for you as well. Okay, so other common trauma reactions can be feeling really guilty, right? So guilt, and remember, guilt is different from shame. So guilt is behavior specific. Guilt will say things like, gosh, I wish I was healthier, or I wish I did things differently, or I wish I went to the doctor sooner, or I wish I encouraged my loved one to go to the doctor sooner. So guilt is about the behavior. And shame is lethal for our mental health. And shame says things like, what kind of person am I? Why wasn't I healthier? Why didn't I come to the doctor sooner? Or what's wrong with me? And shame is lethal, right? Shame lacks compassion and is quite emotionally abusive, right? So guilt can be common. You can see shame as well, that we want to be really curious about if you're seeing a lot of chronic shame, because it is one of those key risk factors for depression, anxiety disorders, or addiction. For many people, there can be survivor's guilt. So that can be a feeling of, why did this happen to my loved one and not me? Why am I okay? Why am I healthy and this other person is not? Okay. And especially for many people on the cancer journey, if they do have or meet others who are also actively living with cancer and someone passes or dies, the feeling is, why have they not made it and I have, right? Very common, and it can be quite a painful emotion to live with. A lot of helplessness, right? Especially when there can be so many doctor's appointments and having to navigate insurance and work, and there can be a lot of helplessness around relying on others to inform us and to make best decisions regarding healthcare when you and your loved ones are already in such a compromised space, like there's a lot of helplessness. There can be waves of hopelessness, disbelief, anger, feeling betrayed, whether that's by the medical community, spiritually. There can be a lot of anger and feeling quite overwhelmed. And remember, trauma is also very cognitive and physical. So you can feel exhausted, foggy, disoriented, forgetful, very common. Now, if you're living with cancer, we know that some of those cognitive symptoms can be related to medicines and treatment, but I'm naming the mental health component to this as well, right? So I'm saying I want you to know that this can also be common when you are living with trauma, and you may experience some of those things. So physically, there can be a heaviness in the chest, a knot in your throat, exhaustion, fatigue, nausea. And I know nausea is very common with a lot of the treatment, but this is also part of a common trauma reaction. Headaches, muscle aches and pain, disrupted sleep, racing thoughts. And for many people, when trauma is fresh, they may shut down and not speak, or you may notice changes in their speech, and just being sensitive to noise and light. And very, very common, people will say, I'm finding it very hard to relate to others. Other people are talking about COVID nonchalantly and wearing a mask or traveling or traffic, and I just don't care. Like none of these things matter to me. And that can happen even with work projects where you're thinking, this used to mean so much to me, but now I don't care anymore. And remember, this is people who have had a close encounter with cancer, but also colleagues, friends, family, thinking almost, what is important to me? Why do I do what I do? And all of these larger existential questions. Certain friends and hobbies that you used to enjoy, you may say, I just can't relate to them anymore. And there are all of these different changes happening inside of us. For many people, there can also be spiritual adjustments. Some may lean into faith and find comfort, and others may feel angry and betrayed or abandoned and say, why do these things happen to good people? And I don't have an answer to that, but what I will say is this is a common reaction to have, and it's important that you don't shame or blame yourself for having these feelings, okay? So we're talking a lot about the freshness of that trauma, and usually when there's a journey, there's a roller coaster of experiences when you come close to cancer. So you can see different trauma reactions in that journey, okay? Now, when any overwhelming moment in that experience is here, there are some things I want you to do and not to do during that time. So when a traumatic situation is fresh, it's important that you allow yourself to feel your feelings. Now, most of us have grown up in homes, communities, and countries where our parents and grandparents have not been taught to feel, and we've actually been taught you shouldn't feel feelings, especially with toxic masculinity, man up, boys don't cry. All of these messages have led to us not knowing how to feel feelings. And we're saying that when trauma is here, it is exceptionally important that you feel feelings. And quite practically, what that means is when you think of emotional intelligence and feeling feelings, it's identify the feeling, acknowledge it, and then we want to regulate it. So for example, if you were waiting for biopsy results, you said, okay, what am I feeling? You want to identify the feeling. I feel fear. I feel helpless. I feel terrified. So you've just identified the feeling, right? And this can be 3 minutes. Second, acknowledge the feeling, and acknowledging it is synonymous with genuine empathy and curiosity, the way you would ask a loved one, how are you feeling right now? We're not trying to fix it or solve it. We don't solve feelings. We want to acknowledge and soothe them. Okay, I'm feeling fear. Where do you feel that fear in your body? I feel it in my throat, my heart, my chest. Okay, and you can say, well, if this feeling were an image, a painting, a landscape, the weather, what would it look like? Is it a mountain? Is it an ocean? Is it a tornado? And we're just getting curious about what it looks like. Once you've acknowledged the feeling, you want to search for soothing, not solutions, right? So that means I acknowledge what I'm feeling. What can I do in these 30 minutes or in this hour that would be soothing or comforting? Right? That's what we mean by feeling the feeling. And that's really important. I need you to not judge what you're feeling. So we often say don't should on yourself, right? I shouldn't feel this way. I should be strong. I should be positive. That's judgment. And that's how you do unintentional harm to yourself or to those around you. So don't say should statements. And anytime you're feeling really emotionally overwhelmed in a close encounter with cancer or living with it in some way or surviving it, you want to approach those huge overwhelming waves by taking it day by day, sometimes hour by hour, right? Really important. Go back to the basics when a moment or day feels very overwhelming. And by basics, I mean all you need to do during that time is breathe, water, food, nutrient-dense meals, movement, and try to sleep, right? Get that healthy amount of 7 hours sleep. That's what we mean. That's what needs to happen in those moments that feel overwhelming and you're wondering, I don't know how I'm going to get through the day, okay? And routine can be really important when we're feeling very anxious. And that would mean, what time do I wake up? What time do I go to bed? What time do I have meals? That's really important when we're in times of crises or just feeling very emotionally overwhelmed. The things you don't want to do, don't feel forced to talk about it. You may have friends, family, or acquaintances saying, what happened? What's going on? What's going to happen next? What are you thinking? Don't feel forced to share the details because it can actually re-traumatize you, okay? So if you'd like to share, then it's okay. And if you don't want to, you may say, I'm not ready to speak about that, or I'd rather not talk about this today. You don't want to use drugs or alcohol to cope. Alcohol is a depressant, so it can create more risk of experiencing or worsening depression when we're feeling a bit low or flat. If you're feeling anxious, do not have caffeine. It's going to make anxiety worse, okay? And you may want to not talk to anyone and isolate yourself. And I'm discouraging you from doing that. I'm also not saying like go and like socialize with everyone. You may want to, that's okay too. But stay close to those who you trust, who you do feel connected to, whether that's 1 or 3 people, is do not completely isolate yourself. We're really social creatures. We're not meant to go at these types of things alone, okay? And you don't want to block out your feelings. That kind of, I just want to numb it. I just want to distract it. Distraction is a temporary solution. So there may be moments you're like, I just can't think about this. I just need to watch something or go do something, and that's okay. But you must then come back to the pain at a later time where you're curious and say, what's here? What am I feeling? What do I need from myself? And is there anything I need from others around me, whether that's my doctors, my friends, my family, my manager, and so on? What do I need from me? And what do I need from them? And to communicate that. When we don't feel our feelings, it's like putting debt on a credit card, right? It doesn't just go away, it stays within our body, as emotions are meant to be released and ventilated, okay? When traumatic situations are fresh, don't make major life decisions. Don't get married, don't get divorced, don't quit your job, don't start a new job, right? These are all really important. Sometimes we just want to divorce ourselves from the pain and engage in radical change. You don't want to do that, because when we're experiencing overwhelming experiences triggered by health scares or health experiences, our frontal lobe, which is the executive of our mind, shuts down. Right? So don't make major life decisions, don't move house, any of that. You may be thinking about it, and I would say notice it, put it on the bookshelf and come back to it later. once you're feeling more like yourself. And the analogy I'll give you is, imagine someone's wound is fresh and open and they're in the ICU and they're just trying to get through the day, right? And we're just focusing on pain management when pain is fresh. And you go into their hospital room and you're like, well, what are you going to do? What are you going to do with work? And are you still going to stay in the country? And what's going to happen? And, or we have to sort this paperwork out. And you're like, I don't know. I'm just trying to get through the day, right? And the same is true with trauma, except for it's invisible. So we tend to dismiss it or minimize it, right? So really important, don't make big life decisions. Now, if you are living with, we're speaking about breast cancer today, but I'm really speaking about any type of cancer. And to be honest, any type of health trauma, all of this content is relevant. That if you are living with cancer, you will experience waves of different emotions. Emotions will not be linear. So there can be waves of feeling okay, waves of feeling strength, waves of feeling helplessness or hopelessness. And the very nature of your emotions and thoughts will make you feel like you are losing control, right? We would say, and I would describe this experience of trauma and grief as like having your back to the ocean and never knowing when those waves may arrive and what may be wrapped in them. So know that if you're experiencing those waves, which almost like 100% of people I've met, experience, it doesn't mean you're going crazy. It doesn't mean you're losing control. That is the very nature of trauma and grief. And what I mean by grief is grief is not just connected to death. Grief is the loss of the dream that you would live life without cancer, that your family or your team, that no one would ever experience that. None of us envision that it will ever touch us that way, right? So there's the loss of the dream of living without it. So that is where we see the grief response coming up in those unexpected waves, okay? And there's not just the loss of the dream of living without cancer, being touched by it. There's also something called secondary losses, which is the loss of feeling healthy, the loss of feeling safe. So it's what I mean by the loss of feeling safe. When we are closely touched by cancer in some way, or our loved ones are, you feel kind of less safe in the world. You think, well, if it can happen to her or him, maybe it can happen to me. Maybe it can happen to my loved one or my mom. And we can feel less safe in the world, right? You may read something or see something online, and you feel more porous as you navigate through the world. You will also be grieving what life was like prior to a cancer diagnosis or prior to that scare, or what you were like before that experience, right? There can be changes in the body that you are grieving, especially with breast cancer, if there's been, partial or, mastectomies or total ones. That there can be grief around the changes in the body, grief around changes in energy levels and hair and all of these different things. You can be grieving that loss. There can also be changes in relationships. Some people don't know how to show up. They can get overwhelmed or they can pull away. And some people you may become quite closer to. So that can also trigger a grief response as well. And for many people, they'll say, I just don't have the same energy when it comes to my work. Many people who are survivors will say my energy levels just aren't what they used to be prior. And for many people, they're also grieving who they were before. So even a sense of identity, they'll say things that I loved and brought meaning to me, like they're different now, that I'm living my life in a different way. And of course, there can be a loss of financial security. Cancer can be incredibly expensive to navigate. And so having to plan for that or having to pay for things, there can be a loss of financial security for many as well, okay? And for many people who have survived an experience with cancer, there can be a lot of that survivor's guilt that I mentioned. And many people will have health anxiety, where even if the doctor is like, okay, you're clear, everything is good, you're thriving, you're good, but there can be more anxiety around, am I okay, am I not? What if something bad happens? And that's really a result of trauma where the mind has a template now that could happen. So there can be more anxiety in regards to your own health and those around you. And the same is true for friends and family members and colleagues who have had close encounters with cancer as well, right? Where you can feel a bit more anxious about your own health, your team's health, or your family's health as well. And there's also something called post-traumatic growth. And this is the bittersweet silver lining that comes with living with or surviving trauma, where you say, now I am engaging with my life differently. I'm more present in my relationships, or I'm spending more time on the projects, people that bring meaning to my life. And you can see people begin to change and have deeper meaning in their life as well. And that's always bittersweet, because we would, if we could opt to not have the trauma, we would, but you can see those changes. I want you to know that grief and trauma they're like sisters. They live very closely together. And with the trauma of coming close to cancer, there's the grief that I've mentioned. And so when you think of grief, I want you to know that it is the internal experience of living with the loss of the dream of health and safety, of not being touched by cancer whatsoever. And that comes in those unexpected waves that I've been mentioning. And I'll talk more about, there's a few things I want you to know, that there's really no endpoint to grief. So even if you have had a close encounter with cancer, you have survived it, your family has survived it, and you're like, I'm doing really well, I'm back to my, normal life in many ways. The grief does not end there, right? So the grief is a loss of the dream that you never imagined that would happen to you or a loved one. And grief, it can be 5 years later and you look back and think, I feel sad that I lived through that, or I feel angry that happened to me or my family. That doesn't mean the person isn't over it, or they're not being thankful or positive. That is the very nature of grief. It has no endpoint, and it comes in those unexpected waves. And it may happen when you're looking at a part of your body, if you had to have surgery and you're like, okay, I'm doing really well, but I feel sadness when I know that my body has went through this, or my family member has went through this. That's not clinical, right? That's a grief reaction. And that's actually quite healthy to allow yourself to experience that and be with that, right? And when grief comes up, sometimes we or family members will be like, come on, you just have to accept it, or at least you're okay now, like look on the bright side. That's not helpful, right? It's okay to allow that wave of grief to come up, to even invite it, allow it to arrive, and allow it to pass. Because how we carry grief in a healthy way is by allowing ourselves to feel it and ventilate it like a teapot. We kind of let the pressure out and then it passes. And we know that if we look at how long difficult emotions last, it's usually about 90 seconds if we don't should on it or minimize it or judge it or push it away or try to fix it. It's actually not that long. Okay. Another myth is that time heals all wounds, right? So if you think like, oh, my loved one is okay now, so it's been 10 years since they had cancer and they've been in remission and they should just be fine now. No, they could, feel anxious anytime they go to a doctor's appointment, or they're just not feeling so great and there's a bit of anxiety that comes up. It doesn't mean that time heals all wounds, as I've named. It can be 20 years later and you think back and think, I feel kind of sad or angry or betrayed that I lived through that experience or my loved one did. And as a grief and trauma counselor, I really, I don't like using the word hate, but I really dislike the word accept. When you say to yourself or someone else says, do you just have to accept this? You're almost saying, stop feeling what you are and just swallow this and digest it. And grief and trauma doesn't work that way. There is only adjustment. There is no such thing as acceptance. You can have weeks and months where you feel quite adjusted to the cancer or what's happened or is happening. And then there can be another hour where you're like, I hate this. I can't believe this happened. That doesn't mean you haven't accepted it, right? There's no such thing as acceptance. There's only adjustment. And some weeks or months you'll feel a lot more adjusted. And there may be other weeks that feel a lot harder or frustrating. And you can almost imagine the weeks and days that may be harder would be things like holidays, or when you're very aware of limitations that you're like, I wish I could wear that or do that, or I wish I didn't feel so exhausted, or and unexpected things can trigger it. Grief is not something that finishes and we're like, okay, it's done, it's closed, it's in the past, right? And another myth is that once you have survived, that you will go back to normal. You will never be exactly who you were prior to this close encounter with cancer. For friends and family as well, where it can change you. And that doesn't mean life doesn't return, but we can see those elements of post-traumatic growth appear as well. So some of these I've already mentioned to you, and I think I've mentioned most of them to you. The only one I'll also say is something that is protective is to hold the tension of the opposite. So that means being able to hold 2 or 3 competing emotions is how we have great mental health, whether there's trauma or no trauma. So that means I can hold the emotion of gratitude, right? Where you can say, I'm so thankful that I have great access to finances or medical team, or that I have that I have friends and family around me that genuinely care, or an employer that is empathic and concerned. You can hold that, and you can also hold, I feel angry, I feel sad, I feel hopeless, I feel scared. We can hold both emotions. They don't compete with one another, right? Where some people will say, well, I should just be thankful, I shouldn't feel all these other things. We want to hold the tension of the opposites and know that that is very protective of your mental health as well, okay? Now, I need you to know that if you have a close encounter with cancer or are living with it anywhere on that spectrum, that you're more, or your loved one is more at risk of developing mental health problems, right? So that means risk of depression, risk of anxiety disorders or addiction. However, it is not normal. It's not that we just assume that, oh yeah, of course she's depressed, she has cancer, or of course he's anxious all the time because, he had that close encounter recently. It's not. There's more risk, but it is not a normal reaction. And we know that when depression or anxiety disorder goes untreated, it can actually make pain symptoms worse, and it can actually shorten individuals' lives who are living with cancer, and the evidence on that is quite vast. So let's take a closer look, and I want you to know what is the difference between healthy sadness, even with trauma, and a sign that someone in your life or you may be struggling with depression. And what you'll find is that depression, you're going to see that the person is no longer enjoying things that once brought them pleasure, right? So even in cancer care, if I look at the journey, you will hear people say things like, when I feel better, I'm going to travel here, or I'm going to buy this thing, or I'm going to go here, I'm going to try that, or, when I feel better, I'm going to work on that project or that book. There is still the dream of joy, and even thinking about it can bring joy, right? Now, with depression and cancer, you'll see that even the thought of that, it doesn't bring pleasure anymore. And there's a pervasive hopelessness and helplessness that's there for most days. And I would say we're talking about, for a period of at least more than 2 weeks, And I would say with cancer, I would say at least more than a month or two, because you can see the trauma reaction where it's common, but then it extends even beyond that, right? And it's most days. And you never ever see suicidal thoughts with a healthy sadness or worry that's there. If you or that loved one is having those thoughts, then we really need to get them connected to a mental health professional. And if in someone's cancer journey, you're hearing an excessive amount of shame where they're blaming themselves and saying, what's wrong with me? Or they feel deeply, deeply defective and they feel at fault, right? Where you're noticing they're being incredibly harsh on themselves. That is also a warning sign to get them connected to a professional, okay? Now, with an anxiety disorder, now some cancer medications can sometimes create a lot of anxiety, right? But still there is support for that. So let's take a look at how you may notice that you or a loved one is experiencing an anxiety disorder. And I'm always naming, we're including friends, family, caregivers as well. Now, when you think of an anxiety disorder, I want you to think of the hallmark sign being, and there's many different types, I'm just giving you the umbrella definition. The hallmark sign would be that the level of fear does not match the situation. Okay, so imagine that the level of fear you're experiencing when you're going to meet a friend for coffee is like you're waiting for a diagnosis, or the level of fear you feel is, like before someone's going into an operation, but you're just waking up in the morning and nothing specific is happening. The fear will not match the situation. Okay, that's a hallmark sign. And also, the fear is beginning to interrupt your ability to function in some way, to get things done, to do what you need to. It may be interrupting relationships or work, okay, or your physical health. Right. So all of these things are signs that someone may be struggling. And another hallmark sign would be panic attacks. So if someone is, and when you think of what a panic attack is, it kind of comes on suddenly and it feels like you're going to die. It's the most extreme form of anxiety. So if someone's experiencing that, we really want them to check in with a mental health professional. And similar to depression, you will see a very loud inner critic, a lot of shame and blame and panic. Now, with cancer, we're naming that when you have a close encounter, those first 2 weeks, you can actually see signs of clinical anxiety. And that would be a common trauma reaction, right? You're like, of course I'm feeling really anxious. I'm like waiting for results. I don't know what's going to happen. I'm terrified. And I'm saying that if even after that period of 1 to 2 weeks, you're like, you've received and you're like, okay, I'm in the clear, but the level of anxiety still feels incredibly elevated and it's interrupting your sleep, your ability to concentrate. If you're feeling really ashamed, helpless, hopeless most days of the week, then these are signs to say, let's check in with the professional to evaluate further what may be going on. Okay, so I want to talk about two things. I think we're doing, I'll speak for like 5 more minutes, maybe 10 more minutes. And I want to talk about how to take care of yourself and what you can do to support someone in your life who may I'm using this word like close encounter with cancer to like cover the spectrum of where people, friends, family may be on their journey. So what to say, what not to say. So when we think about emotional hygiene, there are a few things I want you to be doing anywhere on this journey, and that is mastering emotional hygiene. So what that means is when you are not feeling your best or you're in a vulnerable space emotionally, we don't want to make things worse. Okay, so that means don't connect with people who are draining or overwhelming. You want to reduce clutter, which can activate a threat response. Do not watch the news. Do not watch traumatic movies or shows that can make things worse. And do not go down the rabbit hole of Dr. Google. or posts on Reddit about cancer, and go down that place on the internet where you're reading and engaging with worst case scenarios. Okay, that's going to make things worse. And I find that most people end up doing that. They'll like read the, I'm talking like hours of going down the rabbit hole of reading things that ends up doing a lot of harm. Do not shame yourself or speak to yourself in a harsh way. Think about, am I speaking to myself the way I would someone that I love? Okay. Alcohol and substances are going to make things worse as well. And we know caffeine will make you more anxious. So we want to reduce things that may make things worse, and then go back to that essential self-care, which will be sleeping at least 7 hours, right? If you find that you're practicing good sleep hygiene and you're like, I'm still not sleeping, then that's when you want to check in with a counselor or a GP to say, what can we do to get you sleeping? Because sleep is like that. It's like the essential fuel in the car, right? If we're not sleeping, it's like there's a puncture in the gas tank. Make sure you're eating nutrient-dense meals and drinking at least 1 liter of water, right? When we are dehydrated, it destabilizes our mood as well. Moving at least 5,000 steps if you're able to. Having some type of practice of meditation, mindfulness, going inward, deep breathing is also essential self-care, and having some rest and fun, unstructured fun, doodling, staring out into space, playing with a child, whatever you can do that may be somewhat fun can be really important for you, okay, if you felt okay to do so. We've already talked about permission to feel, and then once you've identified and acknowledged your feelings, then you search for soothing, not solutions, right? So soothing strategies are synonymous with regulation skills. This is emotional intelligence. So it means, it may mean connecting with nature. It may mean taking a walk, a bath, a scent, music, silence, connecting with certain people. And each one of you will have different soothing strategies. So, I don't imagine all of you may watch Oprah videos like I may, right? So be curious about, when I'm feeling highly stressed or not okay, what do I do to soothe or care for myself? And that self-knowledge is gold for having not only good mental health, but great mental health. Okay, so that's what I mean by emotional hygiene. If you notice in yourself, a team member or a loved one, that as they're moving through a cancer journey or experience with it, their trauma reactions are worsening, meaning they're like, I'm not sleeping, I'm exhausted, I'm struggling to concentrate, and their thoughts and feelings are interrupting their life in some way, their ability to function, their work, their relationships, these are warning signs to check in with a professional sooner than later. And anytime, at any point, someone is experiencing suicidal thoughts or panic attacks, we call those mental health crises. You want to check in with a professional. Or if you notice you or a loved one is using an increasing amount of alcohol, substances, or a certain behavior to cope, that's when we would want them to check in with professional support. Now, how to support others. So I love Maya Angelou, and she says, people will forget what you say. I hope you don't forget everything I said today, but people will forget what you say, but they won't forget how you make them feel. And when it comes to supporting someone, it's not about solving, it's about solidarity. Now, sometimes you may practically really help with like navigating paperwork or going to an appointment with someone, but it's more about solidarity. Do not try to fix what people are feeling. Okay. And as a rule of thumb, don't give advice unless it's asked for, really. So anytime you're supporting someone else, though, you must also make sure you're okay first, right? If you're like, I'm on 10%, then don't try helping others. You have to make sure you're okay first. And if you are, then here are some things to consider. Don't avoid saying cancer. Okay, many people will say, no one says it, like no one's saying the word, as if they're going to remind me what happened or what I'm living with. It's okay to say it, right? So don't avoid it or just pretend like it's the elephant in the room that we don't discuss. Don't force them to share details of their journey, like, Johnson, what's happening? I just made that name up. Johnson, what's happening, and what happened with the procedure, and what's going to happen next. And that can actually traumatize the person further. If they want to talk about it, it's okay. We can invite that, but don't force them. If they start crying, don't discourage it. Don't say things like, oh, don't cry, it's going to be okay, or rush to give them the tissue. Just be with it, right? It's okay. It's better that it comes out than stays inside. And don't express pity. So pity is synonymous with sympathy. Sympathy feels like, oh, I feel so bad for you, right? Sympathy is superficial empathy. No one likes receiving it, right? Empathy is that sincere, genuine curiosity. Like, what is that like for you? What would I feel if I were going through that, right? It's more empathy creates connection, not sympathy. Don't say things like it could have been worse. You have to accept this and move on. You all know how I feel about accept now. Don't say I know just how you feel, even if you've had a similar experience, because the circumstances are always different. Don't say things like be positive, be thankful for what you have. You shouldn't feel that way. So you guys know me now, right? So we can hold the tension of the opposites. Don't try to fix what they're feeling. You can be the most thankful person and also be struggling. Don't say you have to be strong for your family or for your kids, or again, we're trying to fix what they're feeling. And empathy never ever begins with at least you have a home, at least you're in Dubai, at least you have treatment, at least you caught it. It's minimizing. It's how we do unintentional harm. Okay. And don't say you'll be okay, even if the person's not. I'm like, I don't feel that way right now. Okay, I'll tell you the things that you can say that are supportive. So offer solidarity through listening. And in my experience, I feel like people don't know how to listen anymore. In my experience, listening is a skill, and it means using open-ended questions and the use of silence, right? So tell me more about how you're doing. Pause. What is this like for you? Pause. It's about being with, companioning. Offer practical support, right? Can I help navigate your insurance? Can I help bring groceries on Thursday? Can I drive you to an appointment? Practical support can be really helpful, but be specific. When we say to people, if you need anything, let me know, no one reaches out. Be specific with what you can help with. And acknowledge what they're living with and surviving through. So saying like, this is really hard. I can't imagine what this must be like for you. And express empathy, right? Which is that curiosity of what must this be like for you? If it were me going through this, what may it be like? You may say things like, so there's two tools with empathy. There's open-ended questions and there's validating supportive statements, right? So we don't want to ask closed-ended questions like, are you okay? Or like, yeah, I'm okay, right? No one who says no, very rarely. It's more of, what has this been like for you? How are you doing? Tell me more about what this month has been like for you, okay? You may even say, what can we do to support you this week, right? If a team member is struggling with any part of that spectrum of an encounter with cancer, each team member will need something different. Some people may need time off, some people may need accommodation, some people may not need that at all. So be curious about what that person needs and encourage them to let you know, right? So you may say, I can't imagine what this is like for you. I'm here to listen if you'd like to talk. There's no right or wrong way to feel. What are you doing to take care of yourself? And I'd like to help with blank, something specific today. Is that okay? All right. So I'm going to stop there. And I took up the whole hour, but I'm going to still look at the questions. What questions and reactions are coming up right now? You can, there's a little Q&A section. So we have, I've lost my mom to cancer a few years back. Dad has been diagnosed 1.5 years later, and he wasn't even managing grief well after losing mom. I tried talking to him about seeing a specialist, but he doesn't believe in any of this. How can I help him? Yeah, I'm so sorry for your loss. It must be really terrifying to also be living with another parent with cancer, and really activating for you. And I'm hearing you say that you're very concerned about your father as he was struggling with his grief. And you're worried about his mental health now as well. He doesn't believe in getting support. So what I would say is be curious with him. Use those open-ended questions. For example, Dad, tell me more about why you are not open to seeing a counselor, right? So we want to get curious. He may say things like, oh, it's just for crazy people. What can they do anyways to help? So you may provide some information and saying, it would be a private space for you to talk about how you're feeling, to process, to have different tools around talking about mom if you wanted to. If he doesn't want to, we can't convince him, right? But you may even say, Dad, would you be open to trying at least 2 to 3 sessions to see if it's helpful? And if it's not, then it's okay. So that may be a starting point as well, but make sure you're also taking care of you. And another thing that we have at the Lighthouse is we have grief consultations. So these are free of charge sessions. They're not counseling. If there's been a death, it's a 60-minute session where we talk about grief, what it is, what it's not, how to care for yourself. And that session is a gateway into our grief support groups. They're free. We have them all year long. So that may be a starting point as well, where he's like, he doesn't really even have to talk. And he can see what it feels like to sit with a counselor as well. All right, thank you so much, everyone. We will share the recording of today's session with all of you. Please give yourself some transition time. We've just sat with a really difficult topic of cancer, trauma, grief, supporting those in your life. So don't go straight back into your email box. Get up, get out of the space that you're in, have some water, take some deep breaths. And thank you for taking the time today to learn more about really mental health and how to care for yourselves and others who are touched by cancer. Take care, everyone. Have a lovely day. Bye.